Hello students, today we will discuss a clinical discussion, case discussion, that is neck swelling, which is very important as far as your long case or short case. You got one long case, one short case. Sometimes some institutions they keep two short cases. So long case, sometimes neck swelling also can be kept, but usually it is kept as a short case, remember, always, most of the time. So a 55-year-old male who is chronic smoker present with a progressive painless swelling in the left side, lower part of the neck since 5 months. So this is the look at this, see the swelling, very typical leg swelling. You could say the skin changes there. You can see the platysma sign, platysma is involved in the swelling. Sternum-masticid muscle also you can see. What other history should be asked? History of cough, dyspnea, fever, hoarseness of voice, hemoptysis, dysphagia, abdominal symptoms, early satiety, dyspepsia should be asked. Remember, fever also important. What inspection findings are present in this patient? It's a large 8 to 82 centimeter globular swelling in the left side posterior triangle supraclavicular region with well-defined margin extending from left clavicle to thyroid cartilage level vertically, horizontally from anterior border sternocleidomastoid muscle to trapezius, and 1 centimeter medial to lateral end of clavicle. Surface nodular, skin is shiny and stretched, dilated veins are visible, sternocleidomastoid muscle is visible over the upper part, no other visible swelling in the neck, same and opposite side, no ulcer or sinus on the surface. This is infection finding, size, location, triangle, maybe level also you have to mention, well localized swelling, skin changes are there, location you have to tell, and distance from the bone is clavicle and other areas also. So it is detailed description of the swelling, and swellings if present in the other area of the neck also you have to inspect and mention. So detailed inspection is important, remember. So everything in the neck always eventually should be referred through in relation to the sternocleidomastoid muscle. That is the key muscle in clinical examination of the neck swelling, remember. So you should know how to contract sternocleidomastoid muscle also. So what findings you look for in palpation? Temperature, tenderness, confirmation of size by measuring the swelling either with the measuring tape vertically and horizontally or caliper. Surface and consistency, skin over the swelling free or not, relation to sternocleidomastoid muscle by contracting either like this or like this or like depending on the site or both sides, like this or like this, and plane of the swelling and mobility important, whether it's fixed or deeper plane or not, pulsations as such. And you have to what other examination should be done in this patient? Palpation of trachea is important, carotid pulsation is important, larynx for laryngeal crepitus. You hold the larynx like that and you can feel the laryngeal crepitus, but from the vertebra and the larynx you get a crepitus. So that crepitus, if it is present, larynx is free, not fixed. So if it is absent, means the larynx is fixed, that means mostly there is a laryngeal CA which is causing the secondary in the neck. So laryngeal carcinoma you have to think of. So left upper limb examination is important. So because swelling is in this region, upper limb, pulse, venous edema is there, or a neurological deficit in the upper limb is there. You have to, especially in the posterior triangle swelling, large swelling like this, and spinal accessory nerve comes there. So shrugging of the shoulder against resistance, you have to check whether it's weakened or not. Then cervical sympathetic chain, features of the Horner syndrome, look at the eye and other features, and this is mainly two things, spinal accessory and sympathetic chain for Horner syndrome. So these are the different levels which you have to remember: 1A, 1B, 2, 3, 4, 5, 6, 7. So this level, oncological levels are important. Always look at this and mention that levels. So palpation of the other neck lymph nodes are so different, important, like whatever mentioned. Oral cavity examination is very important. If there is a neck swelling, examine oral cavity. If there is an ulcer or lesion in the oral cavity, always examine the neck. It is like each other, it is related to each other. If you don't examine oral cavity in the neck swelling, your examination incomplete will be failed. If you won't examine neck in the oral cavity lesion like oral malignancy, oral ulcer, again your examination is incomplete and failure. So always examine each other, always. That's very important. Axillary lymph node examination if you are suspecting lymphoma, respiratory system because aspiration pneumonia can occur, abdominal examination in case any of the liver examination or abdominal paralytic lymph nodes, spleen examination should be done, and spine examination also important if you are thinking lymphoma. What is the clinical diagnosis? Look at this, very localized, and it is palpation hard in consistency. First thing you have to remember is second race in the left side of the neck, Level 5, primary possible area to look for. I mentioned investigations routine and specific, FNAC, CCT neck, chest, look for a primary, triple endoscopy. All of you know that occult primary. PET CT is important. If you won't be able to get the primary, always do a PET CT with the concentrating on the pharyngeal axis as such, because primary may be there, or blind biopsies in different areas. You have to look for fossa of Rothermuller, lateral wall of the pharynx, and sometimes you have to do bilateral tonsillectomy to look at the, especially left side here left side tonsillectomy to confirm the fine primary as such. Even that becomes negative, then you say it is a occult primary after all imaging as such. So final diagnosis important. Remember these congenital condition, inflammatory condition, neoplastic condition, this is how it is classified. Another important thing, most of the time it may be tuberculosis of the neck node, it may be secondaries like what is seen in this patient, it may be lymphoma. These conditions you have to always remember, and additionally HIV you have to remember, other non-specific lymphadenopathy also you have to remember. So lymph node swelling is the commonest swelling in the neck. Other than that, of course, congenital, inflammatory, neoplastic, abscess, other things also come into the picture. Also another classification in the neck swelling is midline swelling, lateral swelling, congenital, inflammatory, neoplastic. Most three important conditions in the exam you have to remember is tuberculosis of the lymph node, secondaries in the neck lymph node, and lymphoma. That's why you have to examine inner valvular ring, axilla, groin, parotid lymph node, liver examination, spleen examination, sternal tenderness, and spine examination, and respiratory system examination. So that all systemic areas also should be, examined to finalize, because entire lymphatic chain has to be examined in this patient, including bone, that is sternum and spine. So students, it's a very common swelling which condition kept in the exam as a short case, that's the neck swelling. So detailed examination of oral cavity is very, very important. Systemic exam is also important, and whatever I have mentioned methodically should present. So please go through my clinical methods in surgery, current edition. It gives a detailed examination method with enough illustrations, and also video lectures are there in that, and my book for detailed conditions about tuberculosis, lymphoma, and secondaries, operative surgery, technique of neck dissection also it will be there, and DigiNor, my video lecture, entire surgery I give to that video lectures are there. You can subscribe and you can have the full idea about the entire surgical topics, whatever your syllabus and which you come across in the exam, as well as for your knowledge purpose. So students, I hope you understood well. Thank you very much.